Hello, this is Aaron Wren. Welcome back to the show. And today I have a very special guest to talk about a very important topic. And that guest is Dr. Ewan Goligher. He is an assistant professor of medicine at the University of Toronto. And he earned that doctor title twice, once with an MD, a second time with a PhD. And he does a lot of medical research focused on respiratory matters around patient ventilator interactions. And for the purposes of our discussion, he's the author of a book called How Shall We Then Die? A Christian Response to Physician-Assisted Death, which is a big topic, especially in Canada. Dr. Goligher, thank you so much for joining me.
Hey, thank you very much for having me on, Aaron.
Like a lot of Americans, I've read a lot about the growth of physician-assisted suicide in Canada, which I guess there is called medical assistance in dying, or MAID, I guess they pronounce it. But for those people who are not familiar with what's going on, can you tell people about this development in Canada?
Yeah, so I guess the first thing to do is just to talk briefly about the terminology. So physician-assisted suicide is when the doctor prescribes a lethal medication and the patient self-ingests. And then euthanasia is the term that describes when the doctor or nurse directly administers the lethal drug to the patient. And those two practices, because they're more or less morally equivalent, get referred together as physician-assisted death, or a little more euphemistically, medical aid in dying, which sounds not all that different from palliative care, but it's profoundly different. So this was legalized in Canada in 2016, about a year after the criminal prohibition on physicians causing death was struck down by the Supreme Court. And so since 2016, the practice has grown exponentially. In the first year, about 1,000 patients sought physician-assisted death. And last year, 2022, which is the last year for which we have official numbers, over 13,000 patients died by physician-assisted death. So it seems to be expanding and growing dramatically. It's widely accepted publicly and professionally, and it's kind of become the new normal in Canadian medicine.
The stat I saw was incredible that 5% of all deaths in Canada in 2022 were as a result of, medical aid and death, or what it's called there. That's an incredible percentage in just a short period of time.
Yeah, it really speaks to the fact that it was almost as if our society was primed for this in a lot of ways. Looking back, when I finished my clinical training in 2012, this was a taboo topic. Nobody talked about it. And 2 years later, everyone was talking about it. And a year later, you have the Supreme Court case, and the year later, it's officially legalized. And in a very short time, there's this massive sea change in kind of the ethos of medical morality around this issue. And, it's so, I think looking back in a lot of ways, the idea of assisted death, the idea of empowering people, of giving them autonomy over the manner and timing of their death, really aligned with Canadian social values and seemed to meet a need that was widely felt about, the problem of dealing with suffering and death. So it's pretty striking and remarkable that it's been so widely accepted, but it's sort of felt very plausible to a lot of people. And I think that's why you see it growing rapidly, along with, a fairly permissive regime that, doesn't work hard to put too many limits on the practice.
How did you get interested in this topic, given your area of research?
Yeah, so I'm an ICU physician, and as an ICU physician, I look after a lot of people at or near the end of life. In the ICU, we wrestle with a lot of end of life ethical dilemmas, decisions about withholding or withdrawing life-sustaining therapies. And some people were trying to draw a straight line from withholding or withdrawing life support to the practice of euthanasia, saying things like, well, we already decide when people are going to die. So what's all that different about this? And I anticipated that there was a real chance that I might have to grapple with some of these issues. And if I was going to be opposed to it, I'm a Christian. Christians have a longstanding traditional opposition to this practice. But if I was going to grapple with the issue and voice my opposition, I would need to be able to explain why. So in a lot of ways, the book is the fruit of years of thinking about how do I find the language to explain why we should oppose this practice. And that's basically how I got involved.
Again, the book is How Should We Then Die? And there's a link to buy it in the show notes. So you might want to check that out. I guess I definitely hear Christian opposition to this, but also it seems like a lot of people have sort of legitimate reasons why this appeals. I mean, there are people who are terminally ill, they're not going to recover, they have cancer or whatever, and they're just in incredible pain. Other people are suffering from, severe and permanent disabilities, and there's basically no hope for them. So, how do you approach problems like that? Both, I guess maybe it's just in your clinical practice as you're dealing with these situations on a daily basis, and then in sort of the kind of moral ethical response to it.
Yeah, I think it's so important to think carefully about why exactly patients seek out assisted death. And there's actually a lot of literature on this. It's something that's been studied and reported on from in multiple jurisdictions where euthanasia and assisted suicide have been legalized. And in general, uh, the reasons cited for seeking this out have relatively little to do with uncontrolled physical pain and suffering, and a lot more to do with this sense that one is becoming a burden, one's losing autonomy, one is finding difficulty seeing a meaning or purpose in going on, and just and feeling like one is losing one's dignity, because the truth is that as we journey towards death, we do lose abilities and freedoms, and it does present a very real threat to our sense of self and of the things that we love and value in life. And so, but it's those kinds of existential and even spiritual challenges around dying and suffering that are motivating people to seek assisted death. And very, very rarely is it actual uncontrolled physical pain. Um, and I would say the reality is that medicine has the tools to not end all pain and suffering by any means, but to control it and to control it effectively. And even in my practice in the ICU, caring for patients at the end of life, we even had to resort to sedating people sometimes to control their symptoms. And we do that when it's necessary. Nobody needs to endure uncontrolled physical agony. And what really drives this is this deep struggle to make sense out of the meaning of life when life, just means grievous and irremediable suffering, which is the language that the law uses to make people eligible for this. So I think it has a lot more to do with those spiritual challenges rather than like the medical or physical challenges per se.
Do you think there are ways that society could address these in different way? How do you respond to someone who may be feeling a sense of hopelessness or feeling they do have a loss of autonomy, or and we hear all this talk about how there is an overburdened medical system, so there are these things that people might think, what is a productive way to engage with people who are thinking that way?
Yeah. So, as I outline in the book, there's a few different core issues underlying the practice. And to me, the biggest one is what I would call a forgetting how much we matter as persons, as humans. And I compare and contrast these two visions of human value: intrinsic value, where you matter by virtue of just who you are, and extrinsic value, where you matter by virtue of what you can do. And I explain that this kind of autonomy oriented vision of human flourishing, where life is worth living to the extent that you're in control and that you're able to get what you want and fulfill your goals and desires. But if you can't have all those things, if those things are being taken away from you, and it's a struggle to make sense out of why life would be worth living, that really presents a kind of extrinsic value where your life is valuable insofar as it's useful to you. And I contrast that with the intrinsic value vision, where we just say, no, you know what, you matter no matter what. and I'm obligated to value you, and you're obligated to value yourself. And the first thing that we can do to remind people of this is to say, this is why I'm unwilling to end you, because I can't call into question the value of your existence without calling into question your value as a person altogether. And so this is why we have to oppose and resist this, because ultimately the practice intrinsically devalues people and unavoidably devalues people. So just by saying, first off, I'm not willing to lift my hand to end you because you matter too much, that is the place to start. Because what we need to do is we need to recover the reality of just how much we matter as human beings.
How much of that was tied to a specific religious impulse that may be no longer present in society, do you think? Do we have as a society the sort of spiritual and psychological resources to think about people that way?
Yeah, this is such an interesting question, and it's one I wrestled with a lot. In fact, it's one I would say that I had a bit of an evolution on in the process of writing the book, because when I first set out to write about this, I had kind of what I might call a kind of worldview based approach. And I was thinking and explaining that, if you're kind of coming from a secular humanist point of view, in a lot of ways, this practice makes perfect sense. If you're coming from a Christian point of view with a very different notion of flourishing and human value, et cetera, it doesn't make sense at all. And so here's why, essentially, if I want to persuade people to oppose this, I also need to persuade them to be Christian. And the evolution was that it just became clearer and clearer to me that a true nobody can really live out the secular. When people talk about worldviews, they like to say that a secular or atheistic worldview is not one that people can live out consistently, because they just know certain things that certain things are wrong and we just can't do them. And I think that speaks to what some people might call a natural law or a natural knowledge of the right, which is that people matter, that people have value. And I think what the approach I ended up taking in the book is to say, look, actually both sides, those for assisted death and those against it, agree that people matter. The people who are for assisted death think that they're actually honoring human value and dignity by giving them death. But that turns out to be a very distorted and deficient understanding of the nature of human value. And when we work out this in a thoughtful and coherent fashion, we actually realize that if people matter, then we can't actually lift our hand to end them. And so that was the evolution, just learning and realizing that we could appeal to what I would call a natural knowledge of right and wrong, that even those who don't come from a Christian background still have some basic knowledge of. And whether you want to call that common grace from a Christian point of view or a natural law theory or whatever, that knowledge is there. And I think we can appeal to it, to leverage it. So is a Christian society going to have more clarity of vision around this? Absolutely, because we have, the kind of background vision of the idea of the image of God, and we can make sense out of this idea that people matter so much. And I write about this in the book. But I don't think that we need to appeal directly to religious belief to make our case that ending life is wrong.
Yeah. It seems like one of the highest values of the world today is this sort of radical autonomy. This idea that we have the ability to define our own identities, that who we are and our desires come from this sort of deep, mysterious place within. They can't be questioned, they have to be affirmed. And, if we adopt that perspective and someone says, that they have judged that their own life is not worth living, then it's almost like this respect for autonomy requires that we affirm again and even pay for, just as we do in other cases, their desire to self-create themselves in their own self-destruction. I just wonder how we, how to push back against that, to say, somebody themselves has judged X, but we don't, we don't want to kind of convince you otherwise. And it's kind of weird because there is the case that, like, we have all these suicide hotlines, and the idea of killing yourself, I think, is still viewed in society as a bad thing. And we need to, literally talk the people off from jumping off a building. And yet when we transport it into this medical therapeutic context, all of a sudden those same impulses maybe become validated in some way. Do you have any thoughts on that?
Yeah, I mean, there's a lot of deep incoherencies about these things, right?
Yeah.
And it's hard for me to sit here and explain them. It's interesting. Colleagues of mine who advocate for assisted death would say that this is actually not suicide. They would try to differentiate it, and in fact, for a while, the American Association of Suicidology, and there is such a thing, had a statement saying that a physician-assisted death was categorically different from suicide. I think they put that out because all of their efforts around suicide prevention, they were worried would be undermined by the concomitant acceptance of physician-assisted death. Interestingly, they've actually rescinded that statement. So I think some people are seeing the light a bit on the inconsistency. But on your point about autonomy and pushing back, one of the things that I like to say to people when I'm having this conversation is about why autonomy is not a sufficient justification for you to have your life ended is I like to say, well, you tell me why I ought to respect your autonomy, and I'll tell you why I ought not kill you. And what I'm trying to say in saying that is the same value that requires and obligates me to recognize that as a rational agent, your autonomy and your decision making bears respecting is the same value that makes you objectively valuable and intrinsically valuable in the first place, and makes it wrong for me to kill you, makes it wrong for me to cause your death. And I think one of the risks that we embark on when we shift from the sacredness of persons to the sacredness of their autonomy is actually we undermine the basis for respecting autonomy in the first place. And that over time, we will be less and less concerned to make sure that autonomy is respected because we don't see persons themselves as mattering, only the choices that they make. And so, you get that now we have, crazy things like Yuval Noah Harari getting up on a stage and announcing that there's no such thing as human rights, things like this that are hard to square with kind of the contemporary social mores. But I think there's a kind of inevitable trajectory. Once you set aside the idea that people matter intrinsically, then progressively you're also going to lose concern and respect for their autonomy more generally.
Yeah. I do want to circle back to sort of the religious perspective on it because I think it's one that we don't necessarily think about that much, So, uh, traditionally, Christianity has had a strong taboo against suicide. Uh, at the same time, it recognized that there are valid reasons that you might kill yourself, in order to save other people. If you fall on the grenade to save your buddies, or you run into the burning building, you take on these risks. I think it wasn't that, like, life had this ultimate value that you could never do it, because Christianity is based on someone who gave up his life for the sake of others. But this idea of essentially ending your own life without purpose was there. Why? Kind of what is the Christian view of this? And, why has the church taught that way?
Yeah, so I would say that, even within the scenarios that you identified, what we're committed to is that we never deliberately and intentionally aim at causing someone's death. We're never trying to end their existence. If you run into a burning building in an effort to save someone and there's a real risk that you're putting your life at stake, that doesn't require you to deliberately and intentionally cause the death of another person. And so, classically, this is referred to as a doctrine of double effect, where you differentiate between intended consequences and foreseen but unintended consequences. And that kind of moral distinction plays into things like just war theory and in my own practice, distinguishing between withdrawing life support and deliberately causing someone's death. When I withdraw life support, the patient often dies shortly thereafter, but I'm not morally responsible for their death because it's actually the underlying disease that ended their life. And I wasn't trying to cause their death when I took them off of life support. I was just discontinuing therapies that weren't achieving their intended benefit. So there are some important moral distinctions, and Christian philosophers and theologians have written a great deal about this to help us think through these concerns. But the common and consistent Christian position is that because humans are intrinsically valuable, and we understand that at a deeper level, as Christians are made in the image of God, that we do not take aim at deliberately causing their death. So I point out in the book that's kind of ironic in some ways, because we actually have more reason to end our life if we're suffering than most other people. We're confident of future glory. Paul himself said to depart and be with Christ is far better. So there's a certain kind of irony that we who expect so much beyond the grave would refuse to do this, but it really it turns on this a deep respect for the intrinsic and incalculable worth of our own value and of that of others.
Well, clearly, the religious position is not the majority in society. And it seems that the trend is towards this. I think The Economist magazine just did a big editorial and story. I think it was The Economist saying that the UK ought to get into this business. And it does seem that, as with many other issues, this has broad public support. And many people who come from a secular background, the idea that you wouldn't support it seems incoherent and cruel. Does it seem? Am I kind of trending this out that this is going to become essentially the norm in societies? That this is just a normal, accepted part of society today?
Well, it's an interesting time, Aaron. I think we're at a bit of an inflection point. In the UK, there's been multiple efforts to legalize assisted death, and to date, none of them have been successful. And a lot of my friends and colleagues internationally are saying that increasingly Canada is looked on as as something of a lesson about what happens when you embrace this practice, because the widespread acceptance and the relatively permissive euthanasia regime in Canada just reflect the belief that death is a kind of therapy. It's just one more tool in the doctor's toolkit. And to the point that now physicians are encouraged to proactively bring it up with patients if they think somebody might be eligible. And they've lost sight of just what you're doing when you suggest to someone that maybe they should consider having their life ended, which is that you're calling their fundamental value into question in the first place, just to say something like that. So I think people around the world are looking at Canada, seeing it as something of a cautionary tale, and recognizing that it's a bit of a Pandora's box. You can't just open this up and sort of restrict it without it logically, by virtue of its own intrinsic logic, progressively expanding and creating some pretty horrific scenarios. So it'll be interesting to see how it evolves. Definitely the advocacy for this is persistent and enduring and highly motivated and well funded. But I think if there's a concerted effort to say, hey, we're against this, and if we can find the language to explain why we ought to oppose deliberately causing death, then I think there's an opportunity to push back and to prevent this from becoming more widespread. So I don't think the game is up quite yet.
It does strike me that in America, I see a number of people who are, even on the left, who look at Canada and look at some of these other things and say, this is not right. And look at the abuse, look less at the theory of it, but than the abuses in the system. And, I've read articles from the CBC, not from, right-wing news, that there have been people who've essentially in Canada pressured to choose the assisted death option when what they really need is housing assistance or they need social services that the country can't afford to provide and doesn't want to provide. Even medical care is in short supply in Canada, kind of famous for long waiting lists. We're famous for high prices. You're kind of infamous for long waiting lists. And so it seems like this becomes essentially a budget tool for governments. So I think there's a lot of concern over that. And then my understanding is Canada was going to expand the use of this program to include people who were interested in ending their lives for reasons of mental illness, which is the case I think in some countries in Europe. You can do that, which of course, if you're mentally ill, how can you meaningfully consent to or say that I want to kill myself? So I do think that there are a lot of people who see that the potential for this to be extraordinarily abusive is high, and that um, there doesn't seem to be a consensus that, like, even if we agree with it in theory, some of these things are not being well received, even by people on the left, secular left.
Yeah, absolutely. I really do think Canada in a lot of ways has become a cautionary tale much faster even than I expected, to be honest with you. And I think one of the one of the reasons for that is the decision in 2021 to remove the stipulation that that natural death be reasonably foreseeable. Up until
Mm.
2021, death had to be in sight, whatever that meant. It was, obviously quite subjective. But nevertheless, it meant that not just anybody could get this. But since then, we've had people who simply feel like life is not worth living because of the disabilities that they're facing by virtue of their health problems. And that's resulted in some really tragic and horrific stories, and has highlighted that at a deeper level, this desire for death and the sense of despair, in a lot of ways, it's driven by intense isolation and loneliness. And we talk a lot about the atomization of the modern West, and that's part and parcel with this commitment to radical autonomy. But the fruits of that, the loneliness, the isolation, mean that people don't have anyone around them to say, no, you matter, and I'm going to take care of you, and I'm going to show you how much you matter in word and deed. And so, really, in a lot of ways, very practically, that's the kind of response that we need to for society and for the church in particular, to gather around these people and to say, no, we need you with us, we want you with us, and we're going to show you how much you matter. But again, once you open the door to the idea that death can be a therapy, then there's all kinds of suffering that seem plausibly treatable with death, and that includes mental illness. And so there is a logic to this that sort of wants to inexorably expand over time.
I guess I want to ask you a question of strategy or tactics, which is one of the things that I see when something appears to be popular. So it's difficult, it's considered kind of difficult or a loser to argue against it directly. Sort of, Christians or others will focus on the abuse cases. So virtually all of the discussion about this in Canada focuses on the cases of abuse. Very little of it focuses on saying this is just simply wrong and we shouldn't do it, quite apart from any abuses. As based on your experience, as a matter of rhetoric, or as a matter of um, what's going to have the best impact in the world, how do you see the difference or the balance between making one or both of those arguments? How should we be making arguments in the public square about it?
Yeah, this is such an interesting and important point. So my point of view on this is that it's been actually a mistake to focus so heavily on the slippery slope issues, because the slippery slope inevitably affects a relatively small minority of cases. And what you're basically seeding the ground on is saying, in theory, this could sometimes be okay, but here's why it could go wrong. And therefore, out of an abundance of caution, we ought to avoid it altogether. But for people who are ideologically committed to the idea that granting death actually empowers people, that it can be a good thing to do, and that people are quite happy to receive that power, that those slippery slope arguments don't end up being all that rhetorically compelling. And in my experience, interacting with colleagues who are supportive of this, the horror cases concern everybody, but they seem to be, at least in theory and from a policy point of view, avoidable if there was there might be a policy solution to this. And when I started writing the book, I wanted to address this question of why and whether this practice is wrong altogether and intrinsically wrong. What makes it wrong to cause death? And I really think that, after reflecting on it and writing about it, that it's A, not that complicated, and B, an incredibly powerful argument to be made, that we can recognize that this practice is intrinsically wrong and in all cases. And that's why I won't be involved at all, and not just in select cases where I think somebody's being taken advantage of. So we need to press that case, and I wanted to give people language to do so. Now, I'm not saying that the slippery slope argument doesn't matter, and I think we can adopt a multi-pronged strategy where we can sort of build progressively on arguments, but I think we need to return to paying attention to this issue of fundamentally saying that this practice does not comport with human value. And in as much as people say that the law is a teacher, what I think we're teaching society is that people don't actually matter as much as we say they do. And the consequence of that is some of these um, abuses and horrific cases that arise. But the primary problem is forgetting just how much we matter.
As a physician in Canada, are you have conscience rights to not participate in these things, or is there a move to essentially force all doctors in Canada to agree to administer assistance in death?
Yeah, so this is an interesting question as well, because as I was, thinking about coming on your show and having followed and read some of your work, I would say that the Christian physicians' experience in Canada after the advent of this is sort of like a prime example of what it looks like to live in the negative world. Because as this was legalized, it very quickly became clear that there was not going to be too much concern or respect paid to people's religious objections to participating in the practice. And when, in Canada, the healthcare is administered at a provincial level. And here in Ontario, where I live and work, the College of Physicians stipulated that if you're unwilling to provide euthanasia, and by the way, the vast majority of physicians are actually unwilling to do this, even though it's technically very easy to do. But the expectation was that they would refer the, the, the patient who made the request to a willing provider. So I would know who's going to do this and arrange for them to see that person, make an effective referral. So make it happen. And for those of us who objected to this, we said, well, that clearly makes us complicit and we can't do that either. So the Christian Medical and Dental Association and a number of other organizations sued the College of Physicians. And we lost that lawsuit not only the first time, but also on appeal. And the judgment of the courts was that guaranteeing access to physician-assisted death was a higher priority than protecting our charter rights, which they said were clearly infringed by requiring us to refer. So Christian physicians and others who object to the practice have had to sort of change their practice, modify, step away from palliative care, and find arrangements where they can practice. Some have retired early to avoid being implicated in this. And so it's been a very challenging
Mm.
season, and people find ways to navigate. But even now, we still don't have full freedom of conscience on the matter. And I think it's important because it's that protection of conscience that creates space, A, for patients to be cared for by people who share their values, and B, for people to speak out and say, here's, I oppose this and I'm not going to be involved, and to call for change. But as soon as you take away that space, then people who are going to be vocally opposed are often going to have to find elsewhere to work and practice.
Yeah, well, this is one of the things that's been a very clear trend, in America as well and in the West, is people talk about freedom and autonomy and all of these things. But what they want to do is essentially force everyone else. You must become involved in other people's choices, to actively affirm them. And if you don't want to do that, we're going to target you and we're going to try to destroy you. So it's a little disingenuous to say that we just want to allow people the choice to end their life. It's not just about that. There's a very important part of it that is about forcing every single person to actively participate in that death. It's not about freedom. And again, we see this in so many areas, and I certainly wish you the best in sorting that in your own career, because you're out there, so you're probably a target now in some respects for some people who don't like you.
Well, I mean, I've been fortunate to have to practice in an environment where I'm able to navigate this without having to violate my conscience. So if a patient was to be in my ICU and request this, I would obviously want to care for them, work through it with them, help them think about it. But if they really persevered in the request, then I would transfer them to a different attending to take over their care, and they could make a referral. And because patients don't get to choose who their attending physician is when they get admitted to hospital, basically I'm stepping out of the way by doing that without actually facilitating it directly. So, yeah, you're drawing moral distinctions and doing your best to navigate things. But fortunately, that particular approach aligns with the requirements of the college. So I've been able to navigate it okay, but it is challenging, and it feels like a threat at some level. And certainly, I agree with you. Obviously, it depends what people mean by freedom, but I would say a better word is power. At some level, what this is about is giving people power that they otherwise wouldn't have. And if you refuse to grant them that power, then you're a troublemaker who can't really be accommodated. And so ultimately, it's a kind of philosophy of empowerment that we're pushing back on, more than a philosophy of freedom.
I have one final question, but before I get there, is there anything else you wanted to say on this topic that I didn't ask you about?
Yeah, so one thing I would want to say to your audience is, like, to me, and this motivated a good portion of the book. To me, this issue is, I don't see physician assisted death as a primary problem, but more as a symptom of a deeper problem, which is this struggle to make sense out of the meaning of life when we're suffering. And I think the reason why people resort to this is because they sort of are looking for redemption or salvation from the despair they feel about their suffering and the dying process. And so, to me, fundamentally, what we need to be doing, and particularly as Christians, is helping people to see that there is purpose and meaning in life, even when we suffer. And it's to the extent that the gospel gives us the resources to suffer well, that I think it can really effectively address this problem. But, my diagnosis of this issue has a lot more to do with the underlying search for meaning in life. And the sense that many people have is that there is ultimately no meaning, that you just self create your meaning. But as soon as you begin to suffer, that meaning is taken away from you. And so there seems to be no point in going on. At bottom, I think that's really the struggle here. And that's the problem that we need to be responding to if we want to effectively address this.
Well, my last question is, you know, Christians in the West are not immune to the questions of meaning and purpose and suffering. If what would you say to someone who is a Christian who is going to basically experiencing and is going to go through these types of extreme events? You're going to die and you're going to suffer in pain, or maybe you're now quadriplegic. You have a severe illness, or you have ALS, or you have muscular dystrophy, and there's just so many conditions that it's never going to get better. It's only going to get worse. You have lost tremendous amount of autonomy. You are completely dependent on other people. Maybe you're actually suffering. You have talents that you can't develop and deploy. How should you think? How should you face that scenario? How do you develop the resources to face that scenario?
Yeah, I think that is such an important question. As I would say that ultimately this is about cultivating and relying on God's grace to exhibit and develop the virtues of faith, hope, and love. When we're called on to suffer, and we all suffer, we all face different trials, we need to be prepared to say, what, I don't understand why this is happening to me, but I trust God. I trust his purposes, and I trust his power to ultimately redeem this for good. So that someday, like Joseph, we can look back on the evils that we experience in life and say it was intended for evil, but God meant it for good, and can say that God brought good out of it, even if that good is not actually realized until the age to come. And the second thing I would say is to cultivate hope. We need to cultivate the truth that ultimately our hope is not in this life, but in the bodily resurrection to come. That one day we will have restored bodies that function perfectly, that will allow us to flourish to our full created capacities. And that's ultimately what we're all hoping for, by God's grace. And thirdly, that I would want to remind that person that even though they're suffering, even though they're disabled and unable to do the things that they want to do and to flourish to the extent that they yearn to flourish, that they still matter, not because of what they can do or can't do, but because of who they are, and that the community needs to gather around them to show them that, by being present, through Christian love, and in the and we still, even in the midst of our suffering, have the opportunity to know and to love the one who made us for himself. And ultimately, that's what our highest good and highest meaning is. And insofar as we can still glorify and enjoy God in the midst of suffering and loss, our life still is, of profound meaning. And so, it's worth pressing on, and soon things will be so much better than they are now. So those would be the words of encouragement I'd have for someone who's going through that, recognizing that, you know, at some level, there's the words can feel kind of trite when you're in the midst of the trial, and that you just need to know and feel the love of others around you. And the thing I would say, more broadly, is that as Christians, we need to sort of equip and prepare ourselves to suffer well, so that when the time comes where we do suffer, or those around us are suffering, we're sort of have the theological structures in place to be ready to deal and to cope with it and to respond well. Yeah, that's basically how I'd respond to that.
Well, thank you so much for those words of wisdom and for coming on the show today. My guest is Dr. Ewan Goligher. He's the author of the book, How Should We Then Die? A Christian Response to Physician Assisted Death. There's a link to buy it in the show notes, so be sure to check that out. Dr. Goligher, thank you so much.
Thank you for having me.